So you're going to start your low back rehab with an exercise that I showed you today called the pelvic bridge. So we were probably in my treatment room and we were doing it on my table, but this can be done. This is the nice part about this one is it can be just anywhere you got a floor available. Sean's going to demonstrate here a pelvic bridge, okay? Some of you guys can't even do this on your first visit here when your back is really acutely hurting, and I always encourage you to kind of push through the pain. So if you're dealing with an exercise here that hurts you, is by no means do you completely push yourself through tons of pain, but by all means, you want to engage the muscles, you want to turn the system back on, and the pelvic bridge is usually a really nice way. Sometimes I'll have to assist you guys in lifting the hips up, which I'll demonstrate with Sean, but many of you notice that after about 2 or 3 reps of some assistance, you could actually engage it yourself, and then sometimes the pain can be excruciating on rep number 1 and be gone by rep number 10. So that's what's this one's so fantastic. It's going to help you to work through some pain. It's going to help you develop a movement pattern that's essential to get your back going and start getting it healed. Again, we want to filtrate fluids through this disc area, through the lumbar spine. That's going to help the healing process quite a bit. It's going to expedite it. So you don't have to wait, lie in bed, hope that anti-inflammatories work, or feel like you need cortisone injections or anything else. These exercises are going to fix pretty much 99% of most low back pain. So let's do a pelvic bridge with Sean here. Okay, Sean, let's have you lift that hip up. Good. So again, oftentimes when people are in acute pain, which means you just hurt your back, I have to come in here and I have to assist and then lower down. And it hurts a lot. It's really hard to push through pain. But it's a very safe exercise. You're not going to hurt yourself further by doing this when you're in pain. That's an important takeaway here. Pain is certainly something to be heeded, but you should not shy away from it to the point where you're lying in bed for 3 weeks in pain and you're not doing anything about it. So you must get your head around that. It's a difficult concept because most people want to shy away from pain. You'll see in a few of the other videos here that pain is usually your guide. It teaches you what's broken and it allows you movement pattern analysis to start working your way back out of that problem. Okay, so same thing, Sean. Pelvic bridge. Coming up to a straight position between the knee and the shoulder and back down. And you'll do 10 reps of this. Just like that. Good. So there's lots of discussion about the full sit-up. Many years ago, I have a video dealing with Craig Liebenson's work on co-contraction mechanisms. The full sit-up was something that was really standard. I mean, anybody that went to elementary school back in the 70s and the 80s, when I was growing up, we had the presidential fitness thing. We did push-ups and we did sit-ups. We did full sit-ups, and oftentimes they would pair you off with another student in school and they would hold your legs. In this case, Sean's going to have his feet tucked underneath this ladder here that I've built for this very reason. And I still love the full sit-up. Here's why. The full sit-up is a really normal motion in life. Getting out of your car, getting out of chairs, getting out of bed in the morning, getting off the couch after watching TV, all require you to do a trunk curl. It used to be called a trunk curl. Many people moved away from this. We started doing bikes, we started doing crunches. There's all sorts of exercises now that people do in the gym that are ab related, but many people shied away from sit-ups. I think it might be coming back now with CrossFit and a few of the other group exercise class things. It doesn't seem to be as demonized as it was, but for many years everybody was saying, oh, don't do a sit-up, it's all hip flexor work. There's no abdominal training in it. I said, there's plenty of abdominal training in this. So Sean's going to demonstrate a full sit-up. So Sean, I want you to reach your hands towards your knees. What I would recommend you guys do for sit-ups is begin. So his movement pattern here is a trunk curl. The center of his movement pattern is right down here by his waist. That's really the middle between his feet and his head. His midsection's in the middle. And that's where the motion's going to come from, the primary motion. So there's a few different little things that I want you to work on. One would be breathing techniques and not holding your breath when you do this. 2 is to start doing full sit-ups here when you're starting and you're trying to develop this as an exercise in your routine. Get the weight close to where you're going. You're going to see, of course, people do sit-ups with their hands behind their head. Well, now I have to lift the entire weight of my arms, which are now strewn back here. That also opens up the torso quite a bit by virtue of the lat muscle, which starts at your low back and comes into your arms. So when I do this, I'm elongating my lat. And biomechanically, that adds a lot of demand to this exercise. But in the position that Sean's sitting in right now, we've taken that element out. We've reached those hands towards where we're going. We've thrown the weight where we're going, and it's going to help a lot. So when you first start doing some sit-ups, I highly recommend you do, because they're fantastic for core strength, as we talk about a lot, or stabilization of the midsection, and a nice functional movement pattern for life. So Sean, go ahead. Let's have you demonstrate a sit-up. He did a beautiful job there, because what he did is he lifted his head, tucked his chin, and then engaged his abdominal muscles and sat up. And that's exactly what you want it to look like. Keep on going, Sean. Another thing he's doing nicely here is his spine is rounding. So as he comes and he lifts off, you're seeing a roundness of his spine. That's really important too. Some of you guys will start to do a sit-up. You look like a rigid board, all straight. Try to let this exercise also be a beautiful spinal curvature, and one vertebrae at a time lifting up as you do that sit-up. Now in a more advanced version, Sean, throw your hands behind your head now. Now we've just done what I said earlier not to do. Now when you master the one that Sean just did, you're going to be working your way into a more advanced sit-up, which is to do it with the arms behind the head. Now tuck your elbows towards each other. By bringing those elbows in together, you've centered your body, that weight of your arms into your neck. You don't want to pull on your head on this one. Go ahead. And all you want to do is cradle your head in the palms of your hands, and you're using the weight of your head, your upper torso, and your arms. You're going to put some demand right on those rectus abdominis. The primary move here, rectus abdominis. I said earlier about core strength. Technically speaking, the core muscles, and that's good, Sean, you can take a rest, is transverse abdominis, internal, external obliques. So there's a lot of debate about sort of core strength. I think this engages all the muscles, it really does. But you could do a plank pose, which is a non-movement of the midsection, and also have the core strength go on. There's lots of different core exercises that would not involve the rectus abdominis. This one involves the rectus abdominis, but it also involves the rest of the core muscles, like internal, external obliques and transverse abdominis. The third level of this one here is I could add to this, is I could give you a weight. Now, there's two ways of holding the weight. Hold it on the sides there, bud. And then put it behind the head. Right there. Now, Sean's going to do a sit-up, and not only does he have his body weight, but now I've added even more resistance. So the third level. First level, arms forward. Second level, arms behind the head, cradling the head to do the sit-up. And the third level will be adding some weight. So go ahead, Sean, do a full sit-up. Again. He's a little back fart. Yeah. And now he's got a weight in his hand, so we've added 8 pounds of weight to the movement pattern. And this is the most advanced of the three.